Hello everyone, this is Shayek Ahmed and I'm a humanitarian worker from Bangladesh, which is located in South Asia. As we all know that from the beginning of this year we have been passing through a critical situation during COVID-19, of course across the globe. The outbreak caught everyone by surprise and the majority of the countries enforced the lockdown to control the spread. This lockdown posed so many challenges concerning several aspects such as our work style, education, psychosocial things, economic and so on. This calls for an urgency to study these impacts, mostly the negative ones, and then come up with strong strategies to diminish them in countries. I'll not get into the detail about the key features of COVID-19 as I can recall or as I should think that by this time all of us already have got the overall idea about the transmission, diagnosis of the disease, risk of the spread of the disease. And of course, till now, we know that there is no concrete vaccine, and there are some hopes, but let's hope for the best because there are no concrete medication procedure or even the concrete vaccine which will help us to prevent the thing for the mass people. We know that COVID-19 emerged in December 2009 in China, and the first case outside China was reported in Thailand. Thailand is located in the Southeast Asian part and of course the South Asia's part, which is really close to China, and the proximity of this region or these countries to China and its vast trade relation with the latter has exposed these regions' vulnerability in terms of getting affected by the COVID-19. In South Asia, of course, the countries like India, Pakistan and Bangladesh are on the rough ride, and the pandemic will affect low-income people from hospitality, manufacturing and transport sectors who have very limited access to the healthcare services or of course to the social safety nets. Moreover, the situation would become severe for these countries with serious pre-existing challenges such as destiny of the their lifestyle, the way they work, overall density of the population, frequent natural disaster or the prevailing climate change issues, insufficient health facilities for the mass, and the partially developed IT infrastructure sector are some of the notable challenging factors. These issues are already raising so many serious concerns in terms of achieving the globally 17 sustainable development goals, for which all of us are providing relentless effort. In Bangladesh, there is another unique dilemma would be to prevent the spread of COVID-19 in world's largest refugee camps of around 1.1 million people, located in Coxbazar, which is located in the southeastern district of Bangladesh. The impact of the lockdown, which is imposed due to COVID-19 to make ourselves protected from the negative effects of virus, and this has led down to unique changes in many of our thoughts. The threat of losing, of course, the loved one from the disease, the job insecurity, social isolation, which will lead to stress, anxiety, and other psychosocial pressures. In general, we have to be very cautious in limiting the negative impacts. So measures such as adopting WHO step-by-step guidelines for countries to develop the National Action Plan would be very vital. The development of humanitarian and the other sectors like the organizations that are working in the development sector as well as humanitarian sectors, along with government, should come forward to reprogram their activities in response to COVID-19. Already Bangladesh government has taken several comprehensive steps which are really good, and now along with the support from all the development and humanitarian organizations, there should be some key areas to focus, and already they have their plans in place. So the major key areas that are in focus are the mental health and psychosocial problems, dealing with that, then the ensuring the food security problems, so there has to be steps which will ensure the food security pass. Definitely there should be focus on the reduced inequality part, which is of course some of the major goals of SDGs. There should be focus on ensuring the overall access to wash facilities, and of course the other strategies related to education, as also the other colleagues actually have mentioned. So we hope that with the strategies in place, soon we will come back on track in terms of achieving all the SDGs, so we'll be in a better shape. And thank you so much for listening to us. Stay well and let's just fight this together. Thank you.